The barriers we face in the San Fernando Valley is getting access to culturally affirming care, specifically when we talk about our BIPOC communities. And then sometimes we don't know how to get LGBT informing care. There's many youth, trans people, people of many intersections who sometimes don't know or don't have the access or the people to connect or the resource or the community to find anything that is LGBT. In the San Fernando Valley, we lack a lot of LGBT anything. And then at least with Somos Familia Valle, we're trying to create that movement and build that community where we could, demand services, show up at the front doors of these people with power to really talk about these issues, especially as people who are always put in the background or people who are always put as a second thought. And what I love about the work that at least I do is we're always at the forefront, and we're here in the 818, and we want just to have simple things like a LGBT center, therapists that are inclusive to our identities and are knowledgeable about our identities, spaces that validate us, that make us feel safe and make us be comfortable, and spaces where we could explore. And that's beyond, health services, where it's like where we could thrive and be leaders and where people could invest in us.
Getting quality and effective mental health care in Amador County feels like our local mental health providers are not trained to work with LGBTQ plus folks, and the dominant culture in our community affirms that LGBTQ plus folks are not welcome in Amador County.
So when I think about barriers for my community, like trying to access mental health, so I'm in Tulare County, and that is a really rural area of California. And one of the issues with access is what is available. So really just trying to give the community a space where they have the opportunity to seek out mental health can be really difficult. So travel is a big issue. The quantity and quality of mental health as well is an issue, and really trying to find out how to best serve our community where we don't have a lot of options.
I would say the biggest barrier is geography, right? Our two-county system is the largest in terms of land mass. We go all the way from the Arizona border to the Nevada border in our two counties, and they're the size of 5 states in the Northeast. And so for folks to get access to culturally competent resources, they have to travel more than 2 hours at times to get access to those services, if they're even available in a nearby town, or they have to travel to a adjoining county. For some people, like in Blythe, they go to Arizona for their services. So it's so geography, the vast size of our counties, and then also that layers in transportation. So our transportation system is not sufficient to support the boundaries of our two counties and getting folks in a reasonable manner from one place to the other. So one thing that's been helpful, especially as a result of some of the challenges during the pandemic, was partnerships with companies like Uber and Lyft, who offer to provide for a certain amount of transportation or mileage, transportation for folks to get access to services. Also, we saw more mobile outreach happening as a way to respond to those barriers. So definitely the size of the counties, and then also transportation has been a barrier.
So I know that what we call California, that landmass is majority rural. So whether you are close to Amador County or not, whomever is watching this, whether you're an ally or you're LGBTQ plus folks, there is a rural community within driving distance of you that needs you to show up and celebrate all kinds of lives, hold hands, be visible. You have no idea the impact that you can have on a queer kid living in the closet down a long dirt road who may never have access to life in the city. And just showing up to rural communities can really make a huge difference. So go connect with your nearest rural community and celebrate freedom, support businesses, and connect with local people who need access to all kinds of ways of thought and being.